Why did I become a doctor? Funny story. It was my grandmother's final conversation with me before she passed. She sat me down. I was a senior in high school, and she asked, "Baby, what do you want to be when you grow up?" I said, "An engineer." And she looked at me and said, "Son, I've never told you what you can and cannot be, but you're not an engineer. You're a doctor. I have seen it." I said, "Okay, Grandma, sure." Unfortunately, she passed actually on my 17th birthday. And I went to college as an engineering major because I'm very stubborn. And halfway through, I kept hearing her voice telling me, "Baby, you're a doctor. I've seen it." I changed my major to biochemistry, and everything just opened up in my mind, and I realized that that was the path that I should pursue. I've been a physician for, wow, almost 20 years now. I finished medical school in 2002 and went through residency. I practiced as an OBGYN for a while, and my wife, who's also a physician, did her fellowship, and when she was done, basically dared me to do fellowship. During my training, gravitated more towards maternal fetal medicine, or the complications of pregnancy, whether it be maternal comorbidities or fetal complications. I fell in love with the relationships that you built with the patients, with their families. I felt in love with being able to be the expert to help explain the process of what was going on and formulating a plan and optimizing the outcomes. And the reward of being able to help a family deliver safely, both for mom and the baby, is what drew me to maternal fetal medicine. So that's why I followed that path. I'm most passionate about making my patients comfortable, creating an atmosphere that makes them feel at ease when they're told that there's a complication in their pregnancy. Whether it be a mom who's had a stroke and she found out that she was pregnant and she's afraid, how will the pregnancy impact her health, and how will her health impact the pregnancy? I'm passionate about making sure that when they come to my office, they understand that I am there to serve them, to make sure that we as a team will get through the pregnancy in as safe a way as possible. There are various advances that have occurred even throughout my career in maternal fetal medicine. Number one, our ultrasound machines have become top-notch, where things years ago we would have missed, now we're able to pick up, diagnose, and help plan for after birth. We're able to collaborate with other subspecialists in order to plan the treatment, to plan the location of delivery, to plan what will happen thereafter. Being a dad, I remember our roller coaster ride throughout our pregnancy. And I remember sitting there as a father-to-be for the first time. That taught me how to put myself in the shoes of my patients. And with that, I have attempted to implement that aspect into my practice. I want patients, families, to be very comfortable when they leave my office. And at the end, we become family. Everyone who comes into my office, I tell them this: I will treat you like my own family. I wish I could do it all. But some of the things I truly enjoy is spending time with my family. I have a beautiful 6-year-old daughter who is my heart. My wife and I make sure that we are involved in her care. I play the violin. I love music. There's so many things that I do outside and I don't even have enough time to do. Nevertheless, my favorite thing is to spend time with my family.